In this special episode of the ASC Podcast with John Goehle, recorded live from the Colorado Ambulatory Surgery Center Association's 2025 Annual Conference and Trade Show in Golden, Colorado, we interview some of the attendees, speakers, and we discuss recent events for the association and the benefits of membership in the association.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 261 of the ASC Podcast with John Goehle for November 14th, 2025, recording from the Colorado Ambulatory Surgery Center Association's 2025 Annual Conference and Trade Show in Golden, Colorado, and from our studios in Spencerport, New York. This is Sue Cronkite, co-host of the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We'd like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of the recording. As such, it is important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by their relevant regulatory bodies. Joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry, and he is a sought-after speaker on regulatory accreditation and finance issues.
So, Sue, this was my last state association meeting for the year. I had
Of many, so
yes.
when you say a sought-after speaker, they weren't kidding this year.
I had a great time in Golden, Colorado. Great to see a lot of people that I've known for many years. This is the first time I've actually been at this conference, and the venue was wonderful.
So what do you love so much about Golden, Colorado?
Apparently they have this day every year where golden retrievers descend on Golden, Colorado. And if it weren't so far away, I think we would be taking our two golden retrievers there who are sitting in the studio with us here, trying to be very patient, waiting for their next food. So we had a lot of great presentations. And, Sue, what was really surprising to me is the heavy involvement of the Department of Health there. The fire department, actually, the fire surveyors were there the entire time. They actually had a booth. And the Department of Health, the health surveyors, were there also to do a presentation. So there were 2 hours of conversation with the surveyors, and I thought that was another sign, just like what we saw in Washington State, a great sign of the involvement of the state association with the State Department of Health. It was also a nice exhibit hall. I had an opportunity to get around to all the exhibits and talk to all the vendors there. They seem to have had a great time. We also had a great holiday party with the vendors in between the 2 days. And again, a great opportunity to get to meet people from Colorado. And I really encourage anybody that wasn't there to consider signing up next year. And Sue, while I was there, I also had an opportunity to talk to some of our listeners, quite a number of listeners from Colorado, it turns out. And one of our longtime listeners and a patron member, Ann Bond, was there also, and I had an opportunity to interview her. So we'll have her interview a little bit later. So let's start with our interviews. The first interview was with Giovanna Grisham. She is a member of the board of directors and very active in the state association. She had some interesting perspectives about the conference and the activities of the state association. So let's listen to Giovanna's interview.
I'm at the 2025 Colorado Ambulatory Surgery Center Association meeting. We're in Golden, Colorado, and I'm here with Joanna Grisham. She is with ASC Insight. Joanna, why don't you introduce yourself and what you do?
Sure. Giovanna Grisham, live in Colorado, up north, outside of Estes Park. My background is I am a nurse, an OR nurse by background in IP, infection prevention. And I entered the ASC space in the early 2000s in Nevada. And actually,
you started the Nevada Association.
Started the Nevada Association.
And by the way, I started the New York Association, so I totally know what you went through. Yeah.
So not to date myself, but I started that association with Simon's dad.
Oh yeah.
Yeah.
I knew them all. Yes.
Yeah. So so we did that for a while, and then I relocated to Colorado. So for my husband, we were coming back home.
Gotcha.
I'm from Seattle, but anyway, so I entered the ASC space in the early 2000s and opened several centers. And have loved it and have remained in that space and really have focused a lot of my efforts on IP in the ASC space because it's
such a big issue.
It's such a big issue. Yeah. And, historically, we haven't paid much attention to that, not intentionally, but, we have a lot of other stuff to do. And so that's kind of been my niche for the last year since I left SCA Health at the end of 2023.
So this is great. I'm a consultant, obviously, in the industry. You are. Tell me, from a consultant standpoint, some of the biggest challenges you have with working with some of the surgery centers out here. I know you work with a lot of the big organizations.
Yeah, I have in the past. I think some of the challenges in Colorado are space, right? So if you look at Colorado, we have the plains on the east, and those are very isolated communities and small. Then you get into Colorado Springs, into the Denver metro area, the Front Range, and now you're up in the mountains. And again, you're back to these small towns that are hard to get to, but highly populated.
Right.
And so we have surgery centers in those places, but they don't always get the same resources that the Denver metro area gets or the Springs get. So that's been a challenge to some degree. Sometimes we even have challenges getting them surveyed.
Yeah.
Weather, mountains. But, one thing that...
Surveyed by the state or for accrediting organizations?
Both.
Or both. Gotcha.
Yeah. So many times, we have been waiting for a survey with Joint Commission in Steamboat, and they call and say, we're stuck.
Yeah.
We can't get there. I think Steamboat did one of the first virtual Joint Commission surveys.
Interesting, yeah.
Yeah, it was odd.
We actually do them ourselves with ambulatory healthcare strategy. We started them during the pandemic,
and
it's been successful. I mean, it is not a replacement.
Yeah, they ended up having to come out, at some point. But I would say also there are some challenges on the payer side. You get into some of these rural areas, and there are some different pay scales, which it works, but it is, now you have kind of the opposite problem. It's a disadvantage down here on the Front Range.
Right.
Staffing. We have trouble in these small towns. I think about Breckenridge, Frisco. It's very hard to get staff and to keep them because of costs and housing availability in some of those areas. Yeah.
And is it across the board in all different nursing techs, et cetera?
I would say, it is. Nursing techs, rad techs.
Yeah.
There might be one person who lives there and they work at the hospital and the surgery center, or they have to drive in and stay there all week. So a lot of our mountain communities have had to create housing programs, which is unheard of for ASCs and inexpensive. So just some challenges there. We still have talked, so we have the western slope, which is on the other side of the Rocky Mountains on the Utah border. So Casca did a great thing where they just started doing conferences separate there. So, everyone shows up there and allows those folks to attend, get education, and get all the resources without having to drive into Denver. So very helpful.
And, of course, you're participating in the virtual ASC conference next week, the 2-day conference. So that will definitely help those isolated areas. And also those organizations that have a hard time getting to a conference like this.
Yeah, absolutely. And, it is tough. I mean, if you drive from Grand Junction to here, it's, you're looking at 6 hours.
Yeah.
And over several passes.
Yeah.
So
that being said, you have wonderful attendance here. I mean, this is my first time.
This is a good year.
Yeah, good.
It's a great year. And I think the organization has done a lot of, that kind of went back to face-to-face contact of showing up in centers, talking to them. Hopefully, some of the board members, we've done a good job of promoting and talking about what we're going to do in the next year. We're talking about the infection control training and how we might beef that up in Colorado to be very targeted to the ASC space. And really focused on what IPs need to know in an ASC.
Right.
So.
That is actually happening with a lot of state associations now, often, if possible, bringing in the state the Department of Health to talk about it. So that would be, sounds like it'd be difficult here because of the the physical isolation. But
we'll need to do I think what we'll try to do is, bi-monthly calls, like a lunch and learn, where we can continue to promote what that meeting was and carry that throughout the year.
When we were talking about staffing, we're actually recording in the exhibit hall here, and I'm looking across at an anesthesia provider. So if you got staffing problems with other people, tell me a little bit about what's going on with anesthesia in the state.
So anesthesia, this actually, in Colorado, we started to see issues with really having enough anesthesia services several years ago, and we were aware that across the country people were starting to have the same issue. We were hit hard, and we have a lot of big groups here, and then we have some small service providers that are specific to, say, northern Colorado.
Gotcha.
But they were having the same issue that everyone was having in anesthesia, and that was generating enough revenue in a day, right?
To be able to make it cost effective.
And we started seeing issues in centers where anesthesia would say, well, I don't want to do your Medicare room. I don't want to do your Medicare cases. And so we saw centers having to pay stipends, right, to meet a daily quota for that group when it came to revenue. We saw providers not wanting to be in rooms where, we had Medicare lined up. Yeah. They wanted those higher acuity cases for obvious reasons. And, we saw one of the things that's notable in Colorado is we don't have a heavy CRNA population. We have more of an MDA model here. Now, we do have some groups that started to employ them, but we're definitely behind. And we continue to see that grow. But for example, Boulder. So Boulder is sort of an isolated area, a lot of healthcare. And the main group that services that area is all MDA. Yeah. And they're very resistant. And so I'm hoping as we start, we talked yesterday in one of the sessions about we're starting to see a return to baseline for salaries with CRNAs and MDAs, that maybe that will help these groups promote and bring in more CRNAs. They're ideal for ASCs most of the time.
Absolutely. And of course, they really have a major presence in most other parts of the country here. But you're right, it is isolated. We see it even in New York and New Jersey. There are parts of the state where it's not a thing. Yeah. So that was a big issue. That's starting to change. But real challenge here. And really for ASCs, we still have a fair amount of what I would term independent ASCs, where they don't have a big management company to kind of assist them through that, and so they struggle. You're on the board of directors here. Tell me about your board membership and what it entails. What do you do?
So it started yesterday.
Oh, really? Congratulations. You must have missed a meeting when they got appointed to the board, right?
I got a call from Simon. But no, I'm happy to do it. So I've been involved, on the fringe for a long time, and always wanted, will help anytime I can. Right. With content and presentations or whatever they need. Vacuuming the floor. But so Simon did reach out and asked if I would join. And we talked a little bit at our board meeting yesterday about opening up to have a little more presence from the bigger companies, where we might get some more representation and some more favorable input. And so we did do an amendment, or created an amendment to our agreement to allow that with some parameters. So, I think that's going to continue to kind of diversify and grow, and allow us to have more input and maybe a little more stake in the game when it comes, to state level.
Right. And they bring more resources.
More resources. Like this, And so, I'm looking forward to the next year. Whatever I can do, but it's a good group, and the state association has been around for a long time. It's been around for quite some time, and it kind of had to be revamped back in the early 2000s, and since then it really has just continued to grow year over year. Yeah,
that's great. It's tough in an environment. We see many state associations struggling right now because they're having a hard time getting out to these conferences, and the challenge is. I got to tell you, with the number of people I see here right now and what the geographic isolation and the staffing problems that you've indicated, you should be very proud of that.
Yeah, they are. They're very, I think it'll continue to grow. Yeah. And, we need to obviously be very targeted with what we are providing and continue to grow that. Because, again, in our space, we just look very different today than we did even 5 years ago.
Very true.
Yeah.
Very true.
With what we have, we're just so highly regulated. And I think we all know that.
Yeah.
But maybe some of our physician owners don't know that. And so getting them more educated, I think we start to see them go, oh, you should go to that meeting. Okay, we're going to send you to that.
And getting
meeting.
the message to them so that they know the importance of letting their employees get out here.
Right. Yeah. And it's a small, this... what we pay for state association it's very helpful to the association, but it's not staggering, and I think it's a good investment.
Well, and on that point, I know a couple of the other speakers are going to talk to this too. Speak to the people that are listening to us through the podcast that are not members right now. What's your message to them?
Yeah, I think overall, my message is join.
Right.
Join us. We are fun.
And we will provide a link, by the way, in the show notes.
This is, it's a great group, and there's not that many meetings that are live, but they're extremely valuable because of the contacts that you make and the things that you pick up. Yeah. And in addition to that, the resources that are available online through the different learning modules, that are available where you don't have to leave your office. Right. You just need to shut the door. But overall, the value is in the people that are here and the people that get together. Yeah. And there's a lot of knowledge. There's a lot of knowledge and wisdom from people that have been in the industry for, 30, 40 years. And there's so much new knowledge of the younger folks that are starting to run some of the centers here in Colorado.
I say this in every single special episode and in regular episodes here, how important it is that these events are not all about the presentations. Though, I'm doing a presentation. Hopefully everybody will be there.
It's going to be very good.
That's right, exactly. But you're more than half, I think, of the event is really that interaction you have with other people.
Yeah, and what you learn. Yeah, and then you have resources when you leave here. Right. Oh, I remember talking to so-and-so about cleaning. Yeah. I'm going to call that person. And the more we can grow that web, the better off we'll be.
And as I look around, again, we're recording from the exhibit hall here. We got a lot of great vendors. Some of the major vendors here are, from throughout the country.
Yeah, really nice.
It doesn't matter whether you're a current client or a potential client. They speak to everybody, and you learn a lot. Yeah. One point I always make, and again, we're speaking to the vendors here. It's just as important to talk to the people that you already have as a client, because I got to tell you, I've learned this lesson many times. Sometimes you have no idea what your current vendor can provide you.
That's right. You might be missing out.
You might be missing out on something else. So.
Yeah. And I think too, the other important part is just the regulatory, right? Yeah. The rules and the all the stuff that we have to be aware of. And this group does a lot of, there's a lot of communication with our state. Yeah. And there's a lot of federal communication. And so that's a knowledge that sitting in a center, you may not get. Right. But attending these meetings, you hear about it, and you don't need to know everything. But if you have the highlights and you're aware of what's going on in the industry that ultimately affects you, good to know.
It's great. And my next interview is actually going to be with the state life safety team, the people that do the life safety surveyors. And as we're speaking, the Department of Health and Health Surveyors are
right
speaking.
Now. So there you go.
Yeah, exactly. Yeah. That's another reason to be here.
Yeah. And we have Dale here in the afternoon, and he's an excellent resource when it comes to life safety and kind of getting your center in shape. And that's the expensive stuff, right? Yeah. So don't want to do that wrong.
Giovanna, thank you so much for taking the time to speak to me.
Appreciate it.
Thanks.
As I mentioned in the introduction, the Colorado Department of Fire Prevention and Control, which is the agency having jurisdiction, or the AHJ, for Colorado State Health Department licensure and CMS certification surveys, had a booth there. And I did have an opportunity to interview Peter Anderson. He was one of I think there were 3 speakers from the Department of Fire Prevention. So, Sue, what was very interesting here is this is the first time that we've ever been able to get somebody from a state agency to be on the podcast here. Usually they have to get all kinds of special permissions, which he did get, but he was able to get them pretty quickly. So let's listen to this interview with Peter Anderson, one of the life safety surveyors in Colorado.
So I'm here at the 2025 Colorado Ambulatory Surgery Center Association Conference, and we're in Golden, Colorado, and I'm here with Pete Anderson. He's with the Colorado Department of Fire Prevention and Control. Thank you so much, Pete, for joining us.
You're welcome.
So the Colorado Department of Fire Prevention and Control is the AHJ, or the association having jurisdiction in the state of Colorado for ambulatory surgery centers when it comes to life safety. Is that true?
It is. So we kind of have a dual responsibility with a local jurisdiction. They're the AHJ on the fire side of things.
Got it.
And then we're the AHJ on the life safety side of things.
Right, the CMS component of it and the state licensure side. And it's great, by the way, I attend a lot of state associations. I think this is my 12th this year, and I have yet to see a life safety person from the state at any of those conferences. So thank you so much for, you're going to do a presentation actually very shortly.
Yes.
On the types of things that you're seeing right now and how to avoid them. Pete, right now, life safety is by far, I would say nationally, that area that people are having significant problems with. And also with regard to condition level citations, that tends to be the area. So here in Colorado, tell me what types of things you're finding now, and what are some of the biggest challenges for surgery centers when it comes to compliance with life safety requirements?
Probably the biggest thing that we see at any time is paperwork. We come in, and that's always what we look at first.
Yeah.
We go to any facility that we have purview over, especially ambulatory surgical centers. And so we always ask for their paperwork first to see what the facility is like on paper.
Yeah.
And so the probably the biggest issues that we have is the maintenance portion of their suppression system, fire alarm systems, and electrical systems, which that makes up the biggest portion of the life safety that people don't really pay attention to a lot. We have a lot of companies come in and service those systems. We found that they do not always do a great job in maintaining them and keeping them up. So then we get a lot of citations initially right off the start of the survey on specifically those three issues. The biggest thing that we do is try to educate the facility, the maintenance staff, if they do have them. But a lot of times it's a nurse that's trying to do the regulatory stuff. And so we try to educate them on what we're looking at and why we need all that stuff to actually be maintained correctly.
So in Colorado, how often do you get out to ambulatory surgery centers? I know that this is a very, very geographically diverse state. I was just talking to another person I just interviewed to talk about how difficult it is really to even get surveys done in some of the parts of the country or the state where, the weather is a factor.
So we're supposed to be in every single ambulatory surgical center at least every 3 years. There are some that are non-deemed. I know you probably know what deemed and non-deemed are facilities. So it depends on if they're a deemed facility or not. Non-deemed facilities, we're in there every 3 years. And depending on if they're a deemed facility, we might be in there sooner, depending on what CMS tells us to do.
Yeah.
We take our workload specifically from CMS, and that's how we where we go do our inspections.
And of course, if the accrediting organization finds something as part of a deemed status survey, you're going to be notified also to take whatever action CMS wants.
Yes, sir.
Yeah. Go ahead.
And it's one of those things that I know for us, DFPC, there are some facilities that kind of slip through the cracks a little bit where we haven't been there for a while, and we're trying to catch up those. A lot of it has to do with because COVID. So we got really, really far behind with COVID, and we're still catching up even with some of our hospitals and ambulatory surgical centers. And but we're making a big stride on trying to catch up. And some of these facilities, because of turnover in the either facility maintenance or staff is pretty big. And so that's probably the biggest issue that we have, because we have a lot of new staff coming in and they don't know what we look at. And so trying to come in and then educate them and trying to get that across to them. And that's the reason why we do conferences like this, is to make sure that we get, I guess, our message across.
Yeah, no, absolutely. So one of the things that we find a lot is when life safety surveyors come out, they find things that have never been caught before. What are you finding in that area, and what should our listeners be looking for to get those things taken care of before you show up and surprise them?
It's We do. We see that all the time, depending on the surveyor that comes out to do the inspection. Even in our department, we've had people that they go to ASCs and don't catch some of that stuff. Probably the biggest thing that we're seeing right now of things that we're catching that some of our surveyors or even CMS surveyors didn't catch before are the rated walls.
Yeah.
So it's those aren't maintained fully. And so then we're checking those because it's been such a huge issue. I don't know if it's just Colorado, but we've had a huge issue in Colorado. And so we're really, really trying to push and making sure those rated assemblies are fully intact, because that's not only does the fire alarm and suppression protect those patients, but those rated walls in those facilities actually protect those patients when they're on their surgery. And so it's one of those things that we're trying to reach out to every facility that we have purview over and trying to mitigate some of those issues with training and teaching.
So that's an important message. I think you're talking here, partially about penetrations too, making sure there's no penetrations between the wall. We know those IT people come out, they take their pencils, whatever, they put something through, and then suddenly you got a violation there. And I've seen it, one day somebody comes and does the inspection, everything is perfect. The next day you got 3 penetrations or sometimes major penetrations. And the thing about that is it's one of the easiest things to fix, right?
Yes.
Okay, and talk about doorway assemblies too. I'm sure that's another issue that you're having too, and since that seems to be an ongoing problem.
We do. A lot of it is because of the climate in Colorado, very dry. Then can get very humid. A lot of the door assemblies, they don't get checked properly. They don't get maintained. So what happens is we have a lot of those door assemblies that start either delaminating or warping.
Yeah.
So then they don't close, especially if it's a fire door. Some of the smoke doors are a little bit easier to maintain, but some of those fire doors are difficult.
Yeah.
And then what we have to do is we have to make sure that they switch those doors out to something that's compliant. The problem that we've had, partly because of COVID, and then we've had some changes in some of the facilities that actually make those doors in Colorado, it's harder to find them.
Yeah.
And so supply and demand, it's been very difficult trying to get those supplies in, or they take a long time. So as you well know, when we have a survey, especially if it's a CMS survey, they only have a certain amount of time to fix those deficiencies. Right. So then if it's something that you can't get fire alarm parts or suppression parts or even door hardware, then what happens is they have to get waivers and stuff. And so we try to work through with those facilities. Doesn't matter if it's just a CMS, if it's a CMS survey or it's a certificate of compliance survey from us, then we try to work with these facilities and try to help them get those supplies and get those things fixed in a timely manner.
And I think a big takeaway here is check these things before you even show up, and well beforehand,
yes.
As soon as you identify a problem, because as you said, the supply chain is very difficult. Talking about supply chain, one of my favorite topics, emergency electrical systems, generators, and all of that. I'm assuming you got the same problems everybody else has nationally in that area too?
We do. And it's all the way going from the surveys, and that's one of the top 3 issues that we have. Other than suppression fire alarm is the electrical, and it's on the generators and things like that service those. They're the backup electrical for these ASCs. They don't get maintained correctly, or they're old systems. We're seeing a lot of old systems that have to be replaced. Well, then it could be 6 months to 9 months to get a new generator.
Yeah.
It takes a long time.
Well, we actually had a client who had to put in a 400 kilowatt generator when they only needed a 200 kilowatt one, because the only one available was this, ultra expensive thing. And of course, way overpowered, but that's the only way they could open on time or be able to avoid violations there.
We get that a lot.
Yeah.
We really do. They end up either having to oversize because that's the only thing that they can get. And it seems like some of the smaller generators for ambulatory surgical centers specifically, they don't make them, or because there's not as much demand for those smaller ones.
Right. So
then what happens is they can't find them. So then they have to go with a higher wattage generator, and it costs more.
Right.
And so a lot of it is, as you well know, the cost of anything that's life safety is really expensive anyway, and it just keeps on getting more expensive and more difficult for these facilities to obtain.
And it's not just getting the generator, but it's maintaining the whole electrical system associated with, with the branches of power. And of course, just as I'm sure you'll point out during your presentation, when you're doing, general anesthesia or deep sedation, that has a much higher level of requirement with regard to the complexity of the system that you have.
It really does.
Yeah. Any other areas that you want our listeners to keep an eye out for here?
Especially for here in Colorado, because we're our division. We try to be very open. We try to train. We try to teach. Reach out to us. We're very phone friendly.
Yeah.
Call me. Ask questions. And that helps these facilities, and it helps us because especially if we have that communication ahead of time,
right,
and trying to fix an issue or have answer those questions that these facilities might have, then call us, and we'll help you get you through that whole process and some of the issues that they might be facing.
Yeah, and it's one of my comments to everybody all the time is you be the one, the client, the center needs to be the one to find the issue, and when you're working with the surveyors, when you're working with the AHJ, that definitely helps them to see that you really do care and that the issue is being mitigated. It just for whatever reason you might not have been able to fix it yet.
Yep, and it did, just like in this conference, we had a facility that came up and said that they knew that they were having some issues because of construction on a different floor, but it's actually impacting their floor. And so, we're not in a survey or ready for that certificate of compliance survey, but told them, call me and we'll come out and we'll look at the issue and we'll try to help mitigate that issue ahead of time, and so it doesn't go into a complaint survey or a CMS survey at that point. That's what we're here to do, is we're here to help.
I think our listeners, one of the concerns they always have is what are the citations that are going to shut me down? What ends up being an immediate jeopardy situation? If you have that type of a situation, what type of situation is it here in Colorado?
We've had a few that an immediate jeopardy situations, if it's going to cause harm to a patient, staff member, a lot of that is non-working suppression system, fire alarm systems, generators. Probably the last 2 or 3 immediate jeopardies that we've had on facilities, and we've had to temporarily close them down from operating, we had one facility that had a facade that was actually falling down on the outside. Some was on the inside. Well, that's the entrance for the patients coming into that facility. If any of that facade actually fell, it could kill someone.
Right.
So it's things like that we look at that are a very significant issue that could be dangerous for those patients. And so we take that very seriously. And the one thing that we do is we don't just make a decision right away. We have a really good working relationship with the CDPHE, the health department here in Colorado, and CMS. Mm-hmm. So we're partners with them. When anytime that we see an issue, we contact them, say, hey, can you come out and look at it on the health side of things? And then contact CMS and say, what do you think? How can we mitigate this? How can we fix this before we try to go to that immediate jeopardy? Because that's not what we want to do.
Right.
So we try to go through any other avenue that we can before going that route. But unfortunately, we've had to do that because there's significant issues on those life safety systems.
Yeah. And again, the takeaway is good testing, good maintenance of your equipment will avoid those situations in the first place.
It will.
Pete, thank you so much. Thank you on behalf of the attendees here for being here the whole time. You've been here you have your own little booth here over to show people things, and I know you've been talking to a lot of attendees, so I can't wait to see your presentation.
Thank you, sir.
And next, I had an opportunity to interview Nick Bachman. He is with the Fox Company, and the Fox Company is one of the pharmacy consultants in the state of Colorado. I had a great interview with him, and he talked about various issues, not only for Colorado, but actually nationally also in the area of pharmacy. So let's listen to that interview. I'm here at the 2025 Colorado Ambulatory Surgery Center Association Annual Conference here in Golden, Colorado. I'm here with Nick Bachman. He is with the Fox Company. Nick, introduce yourself.
As you said, Nick Bachman with the Fox Company. We are a family-owned consultant pharmacist firm. My wife and I own the business. It's been around since 2001. The gentleman recently retired 2023, and I took over. I came from a background in nursing homes, being a consultant pharmacist there, so the jump wasn't huge.
Yeah.
So, however, really enjoying positioning myself to kind of be the answer to a lot of questions in this growing field. So I'm really enjoying myself.
It's funny. I don't know if my listeners even know this, but before I got into the ambulatory surgery industry, I was a consultant in the nursing home industry.
Okay.
I actually owned a nursing home for a short period of time, too. Yeah. So interesting that our backgrounds at least are similar. So, Nick, tell me what you as a consultant pharmacist do for your clients here.
Okay. I mean, in a word, it's compliance. So that is what we're aiming for. Getting folks to do the right thing regulatorily and creating that change, making that change easy for them to do is the goal.
Yeah.
So it's really easy for me to walk around and be an inspector and tell folks what's wrong, what they're doing wrong, and tell them to fix it. I don't know how. It's a lot harder to make the fix, the solution to the problem, the easy thing to do. So I spend a lot of my time trying to influence others to do the right thing and to make that thing easy, whatever that may be. So that's where I spend a lot of my efforts on. Mm-hmm. This includes things like medication management, obviously, is huge. I'm a pharmacist. DEA regulation is another big one. I think a lot of centers try to avoid. Really important, though, in case of an audit from DEA. And then just general cleanliness of facility and how you're running, how you're operating, culture, et cetera. I make actual on-site visits monthly to the centers that have a facility DEA license, and then quarterly if they're operating under a medical director's DEA license.
So you bring up a very good point here, and I noticed your sign actually says, protect your medical director, get a facility DEA license, we can help.
Yep.
So that is interesting. In many states, state doesn't actually allow the surgery center to have a facility license. Talk about the difference between those two and the risks, et cetera, of having a private, as you said, a medical director being your license.
Yeah, so a medical director DEA license, a lot of facilities don't know this. In fact, you'll talk to them and they'll say, oh, no, we have a DEA license under the facility. And then you look at the actual registration, the piece of paper, and sure enough, the doc is on right at the top there. So in the eyes of the DEA, that location, that registration is owned by that doctor, whoever it is. So at any moment, that person can up and leave and surrender their license, and then you're kind of left in the water, scrambling to trying to find another person. You've got to officially transfer those medications. There's a little bit of a process there. When you have a facility DEA, though, you first need a state pharmacy license, which, as you mentioned, not every state allows. In Colorado, we're blessed to have that. Once we have a state pharmacy license, we have a facility. We're able to get a facility DEA license, and the DEA license lives and dies with the facility. Mm-hmm. So there's no way that anybody can up and leave. People can change around, medical practice and medical director, whatever. It doesn't change the license at all. So it stabilizes that area. Mm-hmm. The second thing it does is it takes all the liability off that one person who doesn't generally know that it exists anyway, because they don't know all the regulations involved, which they're actually responsible for. And it places it with the facility itself. And the pharmacist you're working with. Usually a part of having a state board of pharmacy license is you have to contract with a consultant pharmacist. So we're taking a lot of that burden away from the medical director. Once a facility has a facility DEA or medical director or team is used to that, they really don't want to operate any other way. It's just a lot easier for them to quit thinking about that part. So
well, and I have horror stories. Medical directors that leave quickly, especially with the anesthesia crisis right now. The switch over from one to another can be difficult. And actually, the horror story I have is the medical director passed away, and they literally could not operate for a while until they were able to actually fix that particular problem.
That's right. And you don't just inherit, when you change medical directors, you don't just inherit the drugs you bought. There's a process of transferring all those controlled substances from that medical director to the new one. Mm-hmm. I do see it. I think a lot of places are just assuming that they inherit those drugs. Yeah. That's actually not true. You're out of compliance. If they came in and saw that, you'd be in trouble. So
So, Nick, one of the things that I see as a regulatory consultant, as a surveyor, is sometimes that pharmacy consultant that they hire might be a retail pharmacy consultant. Talk about the difference between what you do. Yep. And again, not to put down, I mean, certainly the pharmacy consultants that work in retail, they're wonderful, but they just don't know our industry.
Yeah, that's a big thing we're dealing with now. And there's a lot of misunderstandings with the folks that are contracting with us because they're interested in cost, obviously. Yeah. So you're going to get what you pay for. So if you hire a pharmacist from retail or a little bit better, but not quite there yet, even a hospital, if they're going to have it as a side gig, then that's what you're going to get. You're going to get somebody who's going to go around and check for expiration dates and have a checkbox, usually in pen or pencil. And, you're going to be left with a one-page report, maybe 45 minutes later, 4 times a year. Yeah. So the difference is, me at least, and there's a few of us around the country that this is our full-time job. So we're interested in what's happening next. We talked earlier before this about USP 797, for example, and how to implement that. And then even newer now is USP 800. These are things that pharmacist generally is not going to keep a close watch on. Yeah. It just doesn't impact them in the retail environment like it does in ASCs. This is something we're interested in. The value for us is bringing that to their attention and making those things easy again, so that they are a step ahead of health department, just keeping our finger on the pulse. So that process is easy for the facilities that we contract with. So that is really the whole space for the few of us that are out there that call this our full-time job.
Your presentation today is on USP 797. Why don't you talk about some of the major points that you're going to discuss?
Yeah, so USP 797 is regarding sterile compounding. Sterile compounding right now we all know of as mixing things in a bag together generally, but actually any ASC or any facility, pharmacy, whatever, that pulls a drug from a vial is technically compounding. You're repackaging that drug. So you don't normally call it compounding because you're usually administering it right away.
And you don't think about it that way because there's only one drug involved.
That's right. There's only one drug, but technically you are compounding. So my point is that every ASC is compounding. Understanding those regulations that we all live by, which is the small section in there called immediate use compound sterile products, is important. Now I see a lot of issues when it comes to the intra-OR, so the intra-articular injections that have 5 or 6 drugs mixed together in a syringe and given at once. I see a lot of issues with tumescent when they have 4 or 5 drugs mixed together. So that is actually, they've been out of compliance since about 2008. Yeah. So 2023, they did a small update. It actually made things less stringent. We're still not caught up yet with the surgeons. Again, trying to make that process easier for them, kind of come into some kind of agreement, what this looks like going forward so that we're all happy and in compliance with the national standard is what we're aiming for. So I'm just going to talk about that, educate them on that. There's a little bit of confusion on, well, if I draw a drug from a vial, we're not compounding, so it's okay. I can do it in batches and pull it for the whole morning. No, you have to pull it for the person immediately ahead of you. Yeah. So there's just a little things I notice when I'm on site, getting my hands dirty in these facilities. So.
Well, and talk a little bit about, like in pain management, sometimes when you are drawing up the drugs, you're drawing up from multiple vials. Talk a little bit about what USP 797 says about that.
Yeah, so I actually have a picture on the slide today of a pain center, and I'm sure a lot of pain centers, when you're doing the same thing, or endoscopy centers, same thing, you're doing a lot of propofol, or you're doing a lot of the same thing. You're preparing your morning. So maybe you're preparing a couple of patients in advance, or 4 patients in advance, or whatever. You're actually only allowed per 797 to prepare for the person next. So it says for immediate use, which is what we operate under, but to be used within 4 hours. So you can prepare for that person in the morning within 4 hours of the morning, but you can't prepare for every case you anticipate to have for 4 hours. And that's
really
have
cross-contamination between the different patients.
Yeah. That's where that all comes from. Yeah. And I'll see it all the time. It's a thing. So just re-educating on why we're following the national standard and then showing them the data. That's all based on data. There's studies out there, stakeholder involvement, expert consensus, things like that. So
I think this is kind of obvious, but I, as a surveyor, still find situations where they're using multi-dose drugs inappropriately.
Yeah.
Or single-dose drugs inappropriately.
Sure.
Talk a little bit about that, what you're seeing.
Sure. Well, I see it all the time, punctured vials, multiple times in an OR. So patient care area, that's more of a CDC thing. I know that when we've had shortages of lidocaine with epinephrine. In the past, we've had to get plain lidocaine and then put in our epinephrine, which is fine. However, that vial is no longer not good for 4 hours. That's called pooling. So if you're using that vial for multiple people, you're technically outside compliance of 797. You can mix it, fine, and then you can draw it for one person. So things like that occur with multi-dose vials, single-dose vials. There'll even be big vials. I think of propofol comes in a big vial. That's a single-dose vial. That's to be used for one person. I will see multiple syringes of that drawn up at the ready.
I know, it's frightening. I see that too, and it is so obvious. And the anesthesiologist will, I get it. They're trying to save you money, and they think they're doing a good thing, but it just cannot be done.
Try to think of the long tail of operational efficiency when you're doing this stuff. Quit trying to save the 5 and 10 seconds of, and calling that operationally efficient, because it's a little bit shorter. Think about the infection risk. Think about, even if there is an infection, what process did you follow? How would you feel if you knew that you were outside of national standards and and that person got infected? So think about those things when you're doing that.
Nick, there are things that are going to occur on the daily basis, are going to occur periodically in a surgery center. Medication errors. Talk about when it's time to call the pharmacy consultant in between your regular visits. Yeah,
I tell folks I check my email 100 times a day. Email, I get some texts, I get some calls. If you ever are noticing possible extravasation of a vein, any question about how quickly to run medication, or anything at all, you need to be contracted with a consultant pharmacist that can answer your question. I would say within 15 minutes. That should not be a big ask. Already, most ASCs are open normal hours, so that's really not an on-call thing. And this just all gets back to my point of, hiring somebody, contracting with somebody who is available to you. This is another thing that's a problem, is you can't send your consultant pharmacist an email and get a response in 3 days if you are having a possible adverse reaction, or maybe it's just an irritation to the vein. You should have somebody that can guide you through that process. That sounds like more of an irritation. Mark the area, raise it up. That's not an extravasation. Okay, run it slower, dilute it, run over 15 minutes, whatever it is. You should have that drug expert on hand.
Right. Lastly, let's talk about drug security and, of course, diversion, which is a big topic right now.
Huge one. I think it's super important to talk to local DEA first off and become, be on their radar. They have been a super valuable source for me with regard to just paper regulation, but also in regard to what is the requirement for locking up medications. Yes, if I walk through an area, I should be like a bumbling idiot able to go around and open cabinets, and they should be locked. And if I can open them, then so can a patient, so can any patient family member open them. So you really want to make sure that all that stuff is secured. When it comes to controlled substances, the standard really is the 2 locks. There's nothing in the DEA Code of Federal Regs that says 2 locks exactly. It should just be a substantial cabinet. So if you have a single cabinet mounted to a wall that has a code on it, that is technically okay. So again, you want to make sure that you have at least on site a pharmacy nurse, kind of a DEA, a drug champion for controlled substances. But ideally, you have a consultant pharmacist who's coming in and focusing on DEA regulation more than just your registration, more than just your records of receipt, but also, are you wasting with a witness? What's your perpetual inventory look like? Are they going through everything you received and wasted, and doing chart reviews and making sure that what was used in the case and what was returned back into stock matches up? And any of those areas that only have a single name to them and they're not tied to a witness, that should be rectified. So that's a big topic for us.
Yeah. Nick, thank you so much for taking the time to talk to me.
A pleasure. Thanks, John.
Thanks.
And next, John talked to Ann Bond. She was an attendee of the conference, and she's well known to us as a longtime listener and a patron member. So let's listen to that interview.
So I'm here at the 2025 Colorado Ambulatory Surgery Center Association's annual conference. We're in Golden, Colorado, and I'm here with Ann Bond. Ann, I've known you for so long. You were one of our first podcast listeners, one of our first patrons, and you've been with us a long time. You've gone through a lot of our education programs. And we met at ASCA this year, but this is our first time like actually being able to spend some time. ASCA, I'm always so busy. I'm surrounded by people, but here you and I have had a few moments to speak. And I thought it would be great on the podcast to kind of have a voice of the attendee. In other words, what's been your experience? Why did you decide? Is there any particular presentation that you were really anxious to hear? So first of all, introduce yourself to the audience.
Sure. Thank you. My name is Ann Bond. I'm the administrator at Park Meadows Outpatient Surgery. We're in Lone Tree, Colorado, just on the south side of Denver. I've been there as the administrator 10 years. I've been a part of the practice for 18. So I like to tell people I started when I was 12.
Yeah. By the way, Ann looks quite young here, by the way. She doesn't have gray hair like I do.
No, it's coming. It's well hidden. So thanks for having me. Have loved being a part of this CASCA organization. Loved all of the different opportunities that I have, both on the state and national level. It was fun to be a part of ASCA. Yeah. It was,
right
local
in
car. Yeah, exactly. Right. Earlier this year, I left the meeting going, man, I did not sit through one course about surveys. I did, and I mean, there's a million things that we have to do as administrators, but there was not one course on surveys. And I was getting ready. I was preparing for my survey. We just had our Joint Commission survey. They came in October. So very, very fresh. And I was disappointed, but I also knew, hey, there's a million other things that we have to learn about. So when I saw the agenda for our CASCA conference, it's literally almost entirely about surveys. And again,
regulatory preparedness.
Regulatory, exactly. Yeah. So that I was like, I have got to get there, and it's proved to be really, really important and really useful.
You bring up a good point. So I just finished speaking. I'm grabbing you in the room where I did the speech. I talked about what's going on really with accrediting organizations. But before me, the state surveyors were out here talking about state issues, and then just after them, the life safety team, the HJ for Colorado, spoke for an hour. Yeah. So 3 hours, Ann, of listening to people talking about survey. Yeah. Do you feel like you're a little bit better prepared, or do you think you have a list of things you need to do?
No, I mean, you always feel like you have a list of things that you need to do, but do feel much better prepared. I think it's nice to see faces. I mean, it's scary, if you will. You're thinking about the state, you're thinking about CMS, you're thinking about life safety, but these are people that have jobs that are in the state of Colorado as well. And they're out surveying. I mean, they want us to be better. They want us to abide by rules so that patient safety is at the forefront. And so it helps to put faces with names. Right. It helps to know that they hold a job just like I hold a job, and it makes it a little bit more realistic. It's also nice to see, things that we need to work on are things that are commonly cited. It's not like we're unique, so that's helpful as well.
Well, and I did interview the one of the gentlemen who's with the fire department here, and it was great because he really emphasized how open they are to conversation. In other words, if you have an issue or concerned about going a particular route or doing some construction or need to make some changes to your equipment, to reach out to them, that they'd be glad to answer those questions. You don't hear that frequently from surveyors, and they were delighted. And by the way, they're here the entire conference. They actually have a table in the exhibit hall, so you don't see that very often.
No, before you spoke, I went and talked to the life safety folks, asked them a question. I mean, in multiple times throughout their speaking session, they gave their name, they gave their title, they gave their email address and said, please reach out, and that's why conferences like these are invaluable, because you get those relationships. You can kind of talk yourself into, hey, maybe I will actually reach out.
Right. So you've had 2 days. Without sucking up to me.
No,
but what's been your favorite presentation other than mine?
The one right before yours was all about life safety. And I am not a nurse, and so a lot of the clinical things I delegate to our director of nursing, and so I tend to work on the life safety part. So that was just fascinating. And again, it was just good to be reminded of all the things. It was nice to have them speak. There's a life safety surveyor that comes out with Joint Commission, but you're usually hearing them refer to the standards from the Joint Commission, not the standards that are from the state or the federal register. And so there's a lot of times where I'm like, oh, that's where that came from. Or it kind of helps put the pieces together a little bit.
So another big part of this conference is being able to talk to people. You and I you were talking to a crowd of people. I just happened to be walking by and you recognized you right away. Talk a little bit about that experience, the ability to talk to other people that are doing the same stuff you're doing.
Yeah, I usually try to, either by questions that people ask, identify a few that, they might be like me. Or maybe if they're not, he asked a question that I'm interested in. I don't have a hard time going up to people and just speaking with them. So I think it's so valuable to have, even though we work for different facilities, we're all on the same team and we need each other's help. And so it's really important. I think the vendors, sometimes it feels like, they're going to reach out to me a million times, but those are the people I end up calling when I need something. So it's nice to at least put faces with names, let them know who I am, for when they're reaching out and following up, and just really valuable and small enough that you don't feel overwhelmed by it.
Yeah, and that's one point I want to make. There are a lot of people here, but it doesn't feel like there's a lot of people. Yeah. This room that we're in actually holds about 50 people, and it was pretty full, for the conference. But it didn't I didn't feel like I didn't feel like there were so many people here that I couldn't go up to somebody and just say hi. Agreed. And it's just that's the attitude, the atmosphere that you have here. Yeah. Simon Schwartz, good friend of mine, he's got a way of doing things to really encourage interaction throughout the conference. Yep. And I think that he does an admirable job of putting together a conference that really is interactive and hits all the bases.
Yes, he stopped by our surgery center earlier. It was either this year or at the very end of last year, and so it was nice to get to meet him. Nice to get to just make that connection, and then he recognized me by name when I walked in, and that means something to me.
Yeah. So tell me about your experience in working with the state association too. Other things.
They do an infection prevention conference annually. Back in the day, and I want to say it was a few years ago, they did a lot of virtual things. That's kind of how I got. Obviously it was after COVID, but
you were doing a lot of our conferences, for example.
Yes, that's right. And so that really kind of got me kind of in the groove of like, no, this is important. This is what I want to be a part of. And then that just helped, then you kind of launch back into the in-person thing, and it was kind of like a no-brainer. We're going to do it. And so that honestly helped. But I think being able to just kind of be more local, more focused, have resources, I think it's so valuable.
Yeah, and that brings up a good point too. And again, you being introduced to our virtual conferences during the pandemic, I think we got used to for a while not being in person. Yeah. And just speak a little bit about the huge difference. You kind of alluded to it, but the huge difference. Why should people be showing up in person here?
Yeah, the relationships. That's what matters. Walking up, just a relationship that you might form over lunch, you never know where that's going to take you, or that person that you might call to mind, months later. Yes, it was very convenient to be able to do things, remotely or, but I also found that, I had a second screen going the whole time, and I'm keeping up with my emails, but there's something to be said for just leaving the building, going
not
and
being
being
interrupted.
Going and being with other people and getting the most out of it. And then catching up on the back end. There's so much to be said for that.
It's like drinking from a fire hose. That famous phrase. I love that.
Yes.
That phrase.
For sure.
And lastly, let's just talk about the vendors here. Sometimes we don't. We think about them because they help pay for the bills. Yeah. But their involvement in these conferences is important also. So talk about your experience in walking through the exhibit hall.
Yes. Well, yesterday, one of the first sessions, there was a banker, an attorney, and I can't remember the third one right off the bat, but instantly right there, insurance, that's right. Yeah. So right there, I've got three people who, if I need to switch banks, or if I'm looking for a lender, or hey, I have a legal question, there's a name that I can at least start from, rather than just a Google search. These are they already know the industry, or they at least probably already have a relationship in the industry. And that will save me hours there and above. And so I think, as I walk around, and there's some anesthesia groups, there's cleaning companies, I might not need a new anesthesia group right this minute, but you better believe that I'm going to save my folder for when I do. And so I think that helps a lot. And I appreciate them taking time out of their, day to sit here. This is not what they do, but helping us is what they do. And so I think that just starts a friendly relationship, and I think that's great.
And you bring up an important point too, is that if you show up, and I'm speaking now to the vendors that are listening to the podcast, is that if you want to work in the ASC industry, you got to show some dedication to the industry, which means you got to be in that exhibit hall, and you got to be there every year, because when, trust me, people are already saying, by the way, where is such and such a company? They're not here this year. They wonder what's going on. Is there, is that a sign that they can't afford to come to these conferences or not? They're not doing well. You got to be here consistently. And it's not just for the people you're trying to recruit, but making sure you're talking and keeping good relations with your existing clients too.
Absolutely. Yeah, there's a few existing clients, or we're an existing client for a few different vendors out there. And it's hard to start the conversation, here's who we are and here's what we do. And, I don't know anything about that. I mean, that almost instantly shuts me down, okay, then let me find somebody else where I don't have to explain to you what a surgery center is and what we do. So, and
blatant advertisement for our Patron program.
Yes.
You've been a Patron member for a long time. Yes. What do you find helpful with that program?
I love it. I love almost weekly I'm able to jump on. It's just a group of people. Sometimes it's a small group. Sometimes it's a lot larger. We just talk about common issues. A lot of times there's somebody that's had a recent, like this last Monday, I was the most recent survey. So we were able to talk through a few different questions I had. Sometimes it's just random, like, hey, this happened in our surgery center. And where else are you going to get that? And so it's easy. It's usually during the week. And so it's just, okay, hop on. I can either have it on, while I'm still doing something else, or if it's very engaging, then it's 1 hour of my time where I'm engaged in, I would love to be a resource for someone else, but full transparency, I'm there to learn. And so the more I can do that, the better.
Well, and it's funny. I mean, some people have become such good friends over time. One of our attendees who was there at the last meeting, she had just retired.
Oh, that's right. Yes,
and I asked, why is your background not an ocean?
Yes.
And she had been called back to the surgery center. But see, she'll still shows up even when she's retired, because she just loves, keeping in touch with what's going on in the industry.
Yes. Well, and kudos to you to even host that. I mean, I know it takes hours out of your time, and it's probably not always on the top of mind. You're traveling all around. So kudos to you for continuing to keep that up, and for your podcast and all of the virtual things that you guys do. I mean, just amazing, and just a wealth of knowledge. I highly recommend it.
Oh,
you didn't ask me to say that. So
I didn't pay you.
So I mean it, yes. So, but really, it has really helped me as an administrator. Your wealth of knowledge and the resources are immeasurable.
Well, thank you so much for joining us, and thank you for supporting the State Association, and thank you for trying to encourage people that are not currently members of the State Association to join.
We're going to take a short break, and when we come back, we'll have an interview with Chris Gagan. He is the executive director for the Colorado Association, and he and I discussed the association and all the activities that the association is involved in, as well as the benefits of membership.
If you work in the ambulatory surgery center industry, whether you're an administrator, a nursing leader, a medical director, an owner, or part of the clinical or business office team, there's one resource you should be using to stay sharp, stay compliant, and stay ahead. ASC-Central.com. ASC-Central is the premier online hub for ASC education, leadership development, and ongoing professional support. It brings together decades of ASC expertise, practical tools, and industry-leading training programs, all built specifically for the challenges of the ambulatory surgery environment. One of our most popular offerings is our series of leadership bootcamps, the industry's most respected training programs for ASC administrators, directors of nursing, and business office managers. These bootcamps are not passive lectures. They are mentored, structured, immersive learning experiences that walk you through every aspect of ASC operations and leadership. And many of our bootcamps provide AEU credits for CASC, certified administrators, and IPCH credits for CAIP certified infection control professionals, helping you maintain your credentials while you strengthen your leadership skills. ASC-Central also features a comprehensive collection of on-demand educational programs. These are full-length virtual conferences recorded over the past several years, covering regulatory compliance, quality improvement, credentialing, infection control, finance, governing body education, and much more. These programs are detailed, engaging, and highly practical, and many of them also offer CASC and CAIP continuing education credits. For ongoing access and continued support, ASC-Central offers a range of membership programs. Patron membership, designed for listeners of the ASC Podcast, includes access to regular group Zoom sessions, an extensive resource library, and complimentary access to several key conferences such as the Conditions for Coverage, Medical Director, Credentialing, and Finance and Accounting programs. ASC-Central Premium Access, our most comprehensive membership level, includes everything in the Patron tier, plus full access to all leadership bootcamps, private consultations, live and recorded conference access, individualized staff training, and ongoing interaction with leading experts in the ASC industry. So if you're ready to elevate your knowledge, strengthen your team, and gain access to the most complete ASC education platform available, visit asc-central.com or email us at info@ascpodcast.com for more information. ASC Central, where ASC leaders come to learn, grow, and succeed.
So I'm here at the 2025 Colorado Ambulatory Surgery Center Association Annual Conference. We're in Golden, Colorado. I don't know why I keep forgetting Golden, Colorado here. When I have a golden retriever, and the golden retriever party here is kind of big every year, as I understand it.
Yep.
I'm with Chris Skagen. He is the executive director of the Colorado State Association. Welcome.
Oh, thank you.
So this has been a great conference so far. It started yesterday afternoon. You had a great party last night. I called it a holiday party.
Yes.
The food was fantastic. There wasn't a single thing that was healthy for me, as a low carb guy. But that's okay. We suffer. We suffer through these things. But Chris, tell me a little bit about you and your association with the association.
Oh, absolutely. So I'm a Colorado licensed attorney. I've been working with the Colorado ASC Association and the Oregon ASC Association for the last 15 years.
Wow.
So, a trade association, looking through kind of our three main pillars.
Yeah.
We work through advocacy, education, and community.
Yeah.
So, really, we like to be that, hub for the ASC community, bringing people together, making sure they have the resources so they can succeed and enjoy, have a connection and have a community together here.
This is a great conference. First time I've been to the Colorado meeting, and thank you for inviting me here. It's great. I'll be speaking in an hour or so on survey preparedness here. And I've had some great interviews already.
Wonderful.
I've interviewed the Colorado fire safety people, interviewed a current board member, and pretty well-known individual on the consulting side here. So speak a little bit to the people that are not here. What are they missing today? And what are they missing today with the conference?
Well, I think, today, right now, with this relationships that we have with the regulators in the state.
Yeah.
So, we have the state surveyors, we have, fire and life safety. Really that I think is integral to understanding the trends and, the hot spots, the friction points when you have a survey and what comes in there. Obviously, I think as an expert that you have, you get to highlight the structure and make sure they can avoid those potholes.
Right.
I also think having that periodic check-in is so important for our facilities and our members, as well as our association itself. For us, we like to build that foundational relationship, not only with legislators and regulators, but also our members, and making sure that we start that dialogue and we maintain it. We have a friendly conversation. We'd rather have it be that when there's an issue that arises, because it is a when, not an if, that we can call them up. They know our name. They know our platform. They understand that we're there to help put our patients first, and that is our priority. And we're not trying to do shortcuts.
Yeah.
We want to do it right. And having effective communication is a great tool in ensuring that everybody's doing the right thing.
You said something fascinating. It's not a matter of if, but when. You're totally right. Every surgery center is going to run into some challenge. I got a call from a surgery center the other day who the water went out. Great surgery center, has great surveys all the time, but now they're suddenly dealing with, having to shut down and all the ramifications that come from that. Things are going to happen, just naturally happen here. And the more you learn about how to deal with that problem, both by listening to the speakers here and talking to other people here.
Absolutely.
So when you put together the conference and put together the sessions that are here, what were you thinking? I'm assuming that you get feedback from your attendees here, right?
Absolutely. And I think it's always a moving target, that these trends do shift. And I think that's as we learn the things that come up, cybersecurity was one topic that came up from an incident in Colorado, and we could bring the experts, and hopefully that's a lesson that can be learned. You can learn the easy way or the hard way, right?
Right.
So hopefully when we bring these lessons together, a lot of times it's that way that we can avoid for other people to make those same mistakes and hopefully be more proactively ready to adapt and be able to, if there's a water issue, things like that, emergency preparedness has always been a hot issue. And I think a lot of times people think of emergency preparedness as the blizzard or the avalanche or the flood, and they don't think about when a water breaks.
Something simple.
Yeah, electricity, power outage, having a data leak, things like that. That having those contingencies where they're thinking ahead, and again, most of the time, if you have an issue at your facility, someone else has already had that as well. So what did they do? What resources do they have to make your life a little bit easier?
It was interesting. I was attending that session yesterday on cybersecurity, and you as a lawyer, this is going to be an interesting question for you. Mm-hmm. It was interesting to hear them talking about how important it is, first of all, that as soon as something happens, to contact a lawyer. But they made an interesting point, because that's the first thing I tell people to do, call a lawyer.
Yep.
But they pointed out, call your insurance company to find out what lawyer you should be calling first, because you might end up with, the wrong lawyer or somebody
absolutely.
that would. Yeah.
And in getting advice, I think within insurance and, as an attorney outside of the CASCA world here, I always say, insurance is your friend.
Yeah.
That is another layer of security that, again, there will be mistakes. That to err is human. So having that layer of protection, I think when you bring the right experts in to create structure to avoid that risk, having, a good attorney and a good insurance policy, that does help protect you overall. And I think the other side is that continuity of services as well.
Good point.
So once you hire, once you have the insurance companies involved, they're going to have their preferred litigators that deal with these issues day in and day out. So they're going to know how to posture these things, prepare you, get all the information together. And so again, a lot of times that'll actually save you money and save you headaches that may arise if you select the wrong person. A lot of times you can find an attorney that'll say, oh, I'll take everything. But, maybe that's not the best situation. When you have a specialty issue, you should find that specialty expert that can help support you.
Another point that they made, too, is don't call it a breach until a lawyer tells you that it ended up being a breach. And again, very good advice that I never even thought of. And we talk about it quite a bit on the podcast, too. Mm-hmm. Talk a little bit about, so the people that are not here, what are they missing?
Again, community.
Yeah.
That's that end of, you don't know what you don't know. And I think a lot of times here, finding that connection, whether it's the vendors that are in the sponsor hall here, they're eager to help. They want to find that connection. And also facilities. Again, there's a revolving door. We all know the ASC industry. We see these people hop around from here to there, from state to state. And I think that melting pot that we have, this is a great place to make those connections. And again, it just brokering that network of resources for you. I look at some of our leadership, Giovanna Grissom, you look at Lisa Austin, Rebecca Craig, just powerhouses that know so much information.
Yeah.
A lot of times you can ask them a question off the cuff, or you can go dig through the CFRs and spend 2 hours trying to find the same answer.
Yeah.
And they're good people. Really, a lot of it for us, I always love to come back and really connect with people, not only at our association, but, at the National Association, it's the same way. I think that they have separate and distinct priorities, but are equally as important to make sure that you have a federal connection as well as on the state level. So depending on the issue, whatever scope you're looking at, you have the right resources to plug in and be able to keep running.
You made a good point, too, about like Lisa and Rebecca, national leaders. Rebecca, former president of ASCA, living here and, of course, being on the board here at the State Association.
Absolutely.
Great leadership. Talk about the upcoming conferences that you have, because I know you have other events that go on. Of course, you're participating next week in the multi-state conference. Thank you for that. We already have a great attendance signed up for it, so we're anxious to see how that turns out. But what other live events and what other virtual calls do you have?
Yeah, so, we're going to be shifting into, again, infection prevention. So, again, that's always an important part. When we look at our agenda here, we try to have a well-rounded educational content. So we think about the business office, we think about the administrators, we try to get ones for the material managers, as well as the clinical staff as well. And I think really that is such a hot topic issue that we also have a separate day that sells out every year.
Absolutely.
So we're looking to shift that a little bit more interactive this year, having more tabletop exercises that I think, again, can be applicable for the facilities and making sure they have tool sets that they can bring back and succeed in their positions.
What are the other benefits of membership? Again, speaking to the people that are not members here and certainly encouraging them. I mean, one thing I say all the time, and of course I love ASCA, work with ASCA a lot, but if you only got money for one
one association. I'm sorry, Aska. I tell people join the state association and use whatever leftover money to join the national. Talk about the benefits.
Well, obviously having our finger on the pulse for legislation here, we work very actively with the legislature. Again, I look back on things like during COVID and the suspension of elective surgery that, we had Governor Polis calling me and our board, we assembled on a Friday night, had recommendations for them on the executive order on how to really interact and what that looks like to have an appropriate scope. So, again, I think a lot of these times they will reach out to us to see what's going on. We've rewritten the Chapter 20, the regulatory structure for ASCs in Colorado. And, as we see emerging trends like cardiovascular, we were the ones engaging CDPHE, recommending what policies could be there, what a waiver would look like. And that will then relay into a future conversation of what will that look like as they codify those rules. Yeah. And so as a non-member, they're not at the table. Yeah, and we love to have that conversation. I want to have as much representation, not only from the scope of practice, but also geography, to ensure that it's a well-rounded and rich dialogue full of experts that really fully represent the industry.
Anything else you want to say to the members and to the non-members right now?
Well, we say the door is always open. We would love to have their involvement. Again, for me, that side of, many times a non-member is focused on, their four corners. Yeah. And they think, well, I'm not going to worry about that. Well, the problem is that you need to have the tribe here. We're doing the maintenance work of that relationship to make sure that we're protecting everybody's interest. And so if they have interest in getting involved, please do contact, myself and Simon Schwartz. We love to connect with everybody in the industry and see how we can provide resources that are meaningful for each and every facility.
And I almost forgot about the vendors. Yeah, how important the vendors are. So let's end with that. Talk about the vendor experience here, because a lot of our listeners are actually vendors too.
Oh,
we
absolutely.
Want to learn about the industry.
Yes, well, and again, vendors support ASCs as well. It's a symbiotic relationship. We all build off these relationships, and again, I love these connections and find that way to say, how can we help you? And our vendors here, they really do a great job of being accessible to our members and being super helpful. So, again, we wouldn't be around without our vendor support. Yeah. So that's an integral part to our success and viability.
Are there opportunities for vendors to attend or to sponsor and to be at the next conference?
Absolutely. Okay. We'd love to have sponsors. Please come and talk to us anytime. Give us a phone call or an email. We'd be happy to see how we can plug you in and you can show the value for our membership.
Absolutely. And we'll provide a link for all that information.
Wonderful.
Thank you so much, Chris. It's always a pleasure talking to you.
Thank you very much for what you do.
Thanks. As we wrap up this episode, I want to extend a heartfelt thank you to the Colorado Ambulatory Surgery Center Association for inviting us to be a part of this year's meeting in Golden, Colorado. We really appreciate the opportunity to attend the conference, to spend time with the members, and of course to sit down with so many in attendance to record the various interviews. The openness of the association in sharing their experiences, the challenges and successes is what makes episodes like this possible and helps ASCs across the country to learn and to grow. On behalf of the ASC Podcast with John Goehle, thank you to the association's leadership, planning team, and all of the attendees for their hospitality and for the important work that they do every day for their patients and their communities.
Thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out anytime at comments@ascpodcast.com. A special thank you goes out to our incredible team, sound editor Susan Cronkite, executive producer John Goehle, and our committed research team. Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Zach Kelleritis, Jim Masters, Amy Cronkite, Lori Rodricks, Kathy Fody, Donna Macchio, Christina Norman, and Katie Pearson. Your hard work makes this podcast possible. Our theme music is by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thank you for listening, and I hope you will join us for the next episode. This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.